Hello and welcome, my friends. I'm presenting to you today a very interesting topic, which is about the trios of homeopathy. I've been very fascinated by the trios since very early on, to be honest. And you obviously know about Nash's trio. I worked painstakingly and I've made a list of trios of 36 in number. And these are from different authors, mostly from Nash though. And very honestly, the trios do help a lot in practice, because whenever you're trying to differentiate quickly and you have in your head like these are the top three which can help, and you quickly differentiate and you do the comparative mathematics, and that can help you a long way in your practice. So I'll be sharing with you the trios, but it's not just the name of the remedies. I'll be doing a quick comparative mathematics of the remedies which can help in practice when you're trying to differentiate between related remedies. I'll be doing alphabetically the trios, and as I mentioned, I have about 36. I can't do that all in one go. I'll be doing it in a three or four part perhaps series about the trios, and these are definitely remedies. When you're having a busy practice, you keep those remedies in your head and you can differentiate between the related remedies and doing the comparative mathematics. Without wasting far more time, our first trio of the day is ailments thinking of aggravation. So we are starting with A, ailments thinking of aggravation. When you're thinking of the ailments, the complaints aggravate. And according to Nash, his trio is Helonius, oxalic acid, and Lycopus. Very interesting three remedies, smaller remedies. You have bigger ones in this list which have complaints thinking of aggravation or ailments thinking of aggravation. You have Medrinum, Calcaria Phos, Causticum, where thinking of complaints aggravates, Baryta cup. But he mentions three lesser known remedies as his top for ailments thinking of aggravation. Now if you do a quick comparative mathematics, when you think of Helonia, when you think of Lycopus, Lycopus is a small remedy where it's a hypertensive remedy. A hypertensive remedy which has a lot of hemorrhage. So hemorrhage from the nose, epistaxis, hemorrhage from the mouth, hematemesis, and also rectal bleeding. So hemorrhage in a hypertensive constitution with goiter, with toxic goiter, or nodular goiters in a hypertensive constitution with hemorrhage. That's your Lycopus. When you come to oxalic acid, my friends, is a neurological remedy, and you have a lot of motor paralysis. It influences the spinal cord. It mentions in the introduction of Boricae, it influences the spinal cord. It can produce motor paralysis. It can produce multiple sclerosis, where thinking of complaints aggravate. It has a very interestingly like Thuya 3 AM aggravation, and many of the complaints of oxalic acid are left-sided again like Thuya. So 3 AM like Thuya, and left-sided symptoms like Thuya. And my friends, in case of oxalic acid, you have pain in spots. So pain is sometimes here, sometimes here, sometimes here. So pain in spots like Calibec, and it comes periodically, and that's very important for oxalic acid. So neurological remedy where thinking of complaints aggravates, with Thuya like 3 AM aggravation, Thuya like left-sided symptoms. We come to Helonius. Helonius, my friends, is a wonderful woman's remedy. And in case of Helonius, what's most interesting is the depression, the melancholy is worse when thinking of them. When they are occupied, when they're busy, the melancholy is much better. They're very irritable constitutions. Least contradiction aggravates them. And with Helonius, you also have to understand that they are one of the remedies for bad effects of abortions and miscarriages. Recurrent abortions, recurrent miscarriages causing debility, causing backache, causing uterine prolapse, causing diabetes, causing fibromyalgia with burning and aching in muscles. You'll find the introduction in Boricae, it mentions overtired muscles burn and ache in Helonius. So a menopausal depressed woman where thinking of complaints aggravate, and they're better when kept busy. And so that is your trio for ailments thinking of aggravation. And three lesser knowns, that's important. Remember the top ones, you have Calcaria Phos, you have Causticum, you have Baryta cup, you have Medrinum. Those are top polycris which have those thinking of complaints aggravation. My friends, my next one in this list is Antisoric, trio of Antisoric, or Hahnemann's trio of Sora. And I'm sure many of you know this, that's sulfur, calcaria, and lycopodium. They follow in this order of sulfur, followed by calcarea, followed by lycopodium. You'll find in Allen's keynotes is mentioned sulfur. After calcarea, you must not prescribe sulfur. So the order of chain is always sulfur, followed by calcarea, followed by lycopodium. It's difficult to do a comparison for this trio because this is a trio of constitutional remedies which follow each other well. So many times after a sulfur prescription, the burning was there which goes away. Now the coldness comes in, and that's when lycopodium will come in. The sour discharges come in. After sulfur, what happens? The burning goes away. You'll find the coldness coming in calcarea. The offensive discharge of sulfur goes away. The sour discharges come in calcarea. Now after calcarea, the sour discharges continue and you proceed or progress to lycopodium. So sulfur, calcarea, lycopodium follow really well in that order. So that's very important to understand for that remedy. So Hahnemann's trio of antisoric, sulfur, followed by calcarea, followed by lycopodium. Obviously after you have done your job with lycopodium, you can again go back to sulfur. So that's always, they follow well in that order, and that's very important to understand. So they are not only a trio of soric remedies, but they are remedies which follow each other very well. My friend, sulfur is the king of the kingdom of Sora. Calcarea carb is the queen of the kingdom of Sora, and lycopodium is the prince of the kingdom of Sora. My third in this list of trios, my friends, is trio of brain typhus. Trio of brain typhus. We are going alphabetically. B for brain typhus. And the trio of brain typhus is Apis, Helleborus and Zinca. Now when you consider brain typhus, it may be an old terminology, but you have to understand all these remedies have influence on brain disorders. All these remedies have influence on convulsions, meningitis. And you'll find with all of the three that they are boring the head into the pillow. They're rolling the head from side to side. Sometimes they're beating the head with the hands. So all of them have meningeal symptoms where they're boring, where they're rolling, where they're beating the head. You'll find it common with Apis, Helleborus, Zinca. And it's Nash's trio of brain typhus. Now you have to understand, to do a quick comparison amongst these three remedies. Whenever you consider Apis, all of these again have influence on hydrocephalus. But Apis is a top dropsical remedy. So it will help in absorption of the excess fluid. Apis is dropsy without thirst, my friends. And with brain symptoms, with neurological symptoms, what you find with Apis, they drop things from their hands. They're holding something and they're suddenly dropping things from the hands. So awkwardness, you have that in Bovista, you have that in Atmure. But with brain symptoms, when you find awkwardness, patient are dropping things from the hands, that's classical for Apis. And with Apis, you'll often find a cry encephalic, a shrill cry, which is piercing cry, again with meningeal disorders, with brain disorders. So dropsy without thirst in a constitution who is dropping things from the hands, who have very shrill cry encephalic, that's the word, cry encephalic. I've shared this in my video on cough and on my video on cry sounds. You can hear that as well, cry encephalic. And with Apis, you'll find a lot of heat aggravation, touch aggravation. You touch their head, you touch their brain, it's sensitive to touch. So that's very important for your Apis. When you come to Helleborus, with brain disorders, with brain typhus, one of the common things, my friends, you have to understand is sensorial depression. What do you mean by sensorial depression? That's the first line in Borike, produces a picture of sensorial depression. With the hydrocephalus, with the brain disorder, my vision is deteriorating, my hearing is deteriorating, my smell is deteriorating, my taste is deteriorating. So all the 5 special senses are affected and they're gradually diminishing in their ability. So vision, smell, taste, touch, all are deteriorating over time. So that's a sensorial depression in Helleborus. In a patient where you'll find acute idiocy, you look at him, it's a vacant look, it's a staring look, it's a thoughtless look. Sometimes you'll have involuntary sighing in Helleborus. Again, with a typical 4 to 8 p.m. aggravation, that's quite important for Helleborus, 4 to 8 p.m. aggravation. And many times they're picking their lips, they're picking their bedclothes. So that's also quite important for your Helleborus. So a brain remedy where you have sensorial depression, all the 5 special senses affected, that's a catch for Helleborus. In a patient who has a 4 to 8 p.m. aggravation. In a patient who has a picture of acute EDSC, that's the line in Allen's, acute EDSC. Why? Because he's thoughtless, staring, slow in answering, involuntary sighing sometimes instead of answering. And that's very, very important for a Helleborus. My third remedy, my friends, in this list is Zincum metallicum. You have to understand for Zincum metallicum that the mind is in a state of underactivity. So the brain fag of Zincum. Fag is the word to describe Zincum. Remember, Bert said what iron is to the blood, zinc is to the nerves. So you have the fag in case of Zincum, the brain fag. So memory is weak. Echo speech, they're repeating things again and again, whatever they have been asked. In a patient who has physical hyperactivity, what's physical hyperactivity? Restless legs, fidgety legs, constantly eating, greedy at 11 a.m. like sulfur. So physical overactivity, emotional underactivity. And many times with the brain typhus, with the brain disorders, there is twitching of the muscles in Zincum. The muscles tend to twitch. So remember, emotional underactivity with the poor memory, with the poor concentration, but physical hyperactivity with the fidgety legs, with the excessive eating, and that dignifies and classifies your Zincum. So that's, my friends, is your trio of brain typhus. The next one in this list, my friends, is number 4, is trio of burning. And when you consider the trio of burning, you have that your top is arsenic, phosphorus and sulfur. Arsenicum, phosphorus and sulfur, 3 of the greatest polychrists. Now quickly, if you have to differentiate between these top 3 for burning, one of the things which will always come round to you, especially with burning with arsenicum, is always they're better by heat. All burnings of arsenic is better by heat. Remember, arsenic wants hot everywhere except the head, which they put in the fridge, because the head is better from cold application in arsenic, but the rest of the body is always better by heat in arsenic. So that's very important. Whereas in case of sulfur, the burning is better by cold application. The burning is always better by cold in sulfur. So the sulfur, when they have the burning, they will toss on the floor because the cold floor makes them better. So burning better by cold. Now with phosphorus, you can also have burning better by cold in phosphorus. But you have to understand 2 things here for phosphorus. Many times the burning of phosphorus is in the disease of the nervous system. So neurological burning is important for phosphorus. And with phosphorus, you'll also find that the burning is in spots along the spine. So there's a burning here, a burning here. So in spots the burning comes. Especially in diseases of the nervous system, burning along the spine you can find with phosphorus. But you have to understand, although both are better by cold application, constitutionally they are vastly different. Sulfur is hot, phosphorus is chilly. Sulfur has desire for sweet, phosphorus has aversion to sweet. The fastidiousness of phosphorus, the untidiness of sulfur. So those are constitutional symptoms which are different. But again, if you consider just burning, in sulfur the burning is always associated with redness, is associated with congestion. Whereas in case of phosphorus, the burning is associated with many times with hemorrhage. So there is bleeding from the orifices in phosphorus. Whereas you will not find that degree of bleeding in case of sulfur, which is also very important to differentiate. Number 5 in this list, my friends, is another very important remedy. Another very important trio is, we come to, from B we come to C, the trio of cholera. The trio of cholera is again Hahnemann's trio of cholera, Hahnemann's trio of Asiatic cholera, which was very predominant at that point of time. And my friends, that includes the 3 remedies is camphor, cuprum and veratrum album. Camphor, cuprum and veratrum album. Now again, if you consider in today's world, there's no cholera or very little chances you'll come across cholera, but you'll get cases of gastroenteritis, you'll get cases of acute purging and vomiting. And in those cases, this trio will always come to your rescue. When you consider camphor, you have to understand the patient vomited once or patient vomited twice, and in spite of the scanty discharge, they are collapsed, they are exhausted. So scantiness of discharge with collapse, that's the characteristic of camphor. And with camphor, the body is cold, you touch it, it's cold, your hands, the feet are cold. But in spite of the coldness, they don't want covering, they throw away the covering. Medurinum sickle cord does have that as well, that their body is cold to touch, yet they do not want covering, they throw off the covering. But in case of camphor, what's important is they are exhausted, they are prostrated in spite of the scanty discharge. They're prostrated, they are exhausted, although there is very little discharge. You're wondering, how is he so collapsed? He has just vomited twice. And that's the beauty of camphor. That's the peculiarity of camphor. So scantiness of discharge in a patient who has coldness but throws off the covering, like medrhinum, like sickle cord. When you come to the remedy cuprum metallicum, my friends, do always remember cuprum, C for cuprum, C for cramps. Cramps and spasms in cuprum. So cramps in cuprum in a patient who has a coppery metallic taste, and that will always help you towards cuprum met. So in a picture of dehydration with vomiting and purging, and there is a lot of cramps in the muscles, cuprum met will always come to your rescue with cramps. And the third in this list is veratrum album. Veratrum album, my friends, is a very important remedy for gastroenteritis or trio of cholera. Why? Because you will find profuse discharge. Whenever he is vomiting, he is just vomiting his guts out. Whenever he is passing stool, he is passing his guts out completely. So profuse discharge, and he is collapsed because of the profuse discharge. His body is cold to touch, his hands and feet are cold to touch. But what's interesting, in spite of the coldness, they want very cold water, thirst for very cold drinks like phosphorus. So icy cold drinks, very cold drinks, large quantities in veratrum album. And along with that desire for cold drinks, they want juicy things, refreshing, sour things, and that's also important for veratrum album. So coldness does not want the covering, that's camphor, and coldness with desire for very cold drinks, that's your veratrum album. And in case of camphor, it's scanty discharges. In case of veratrum, it's profuseness of discharge, and that's very important for this trio.